Hey everyone. Last time we talked about the first topic in chapter 1 of the BNF, chronic bowel disorders. Do you remember that? Well, today we're moving to the second topic, constipation and bowel cleansing. So grab your short notebook now because we're going to write this down step by step. And always remember, every small note you make takes you one step further in your medical journey. All right, let's dive into bowel cleansing together. So, what exactly is bowel cleansing? Well, it's basically a way to clean out the bowel using special medicines. Doctors usually ask patients to do this before tests like a colonoscopy. Why? Because these medicines flush everything out, leaving the bowel completely clear. Think of it like this. If you want to take a perfect photo, you don't want anything blocking the view, right? That's exactly what bowel cleansing does. It prepares the intestines for a clear picture so the doctor can see everything properly without obstacles. Now, let's break down bowel cleansing medicines. There are mainly osmotic laxatives. Don't worry about the details now. We'll cover these laxatives more when we talk about constipation. Just keep this in mind. Okay, some of these are osmotic laxatives like citric acid with magnesium carbonate. They pull water into the bowel and flush everything out. They're usually taken the day before a procedure, sometimes in split doses depending on age. Then we have large volume solutions like polyethylene glycol, PG preparations. Adults often take 1-2 liters, either the night before or divided between night and morning. They work by filling the bowel with fluid, cleaning it completely. There are also stimulant laxatives combined with osmotic agents, which act faster, usually within a few hours. Doses vary for children and adults, and timing is important so the bowel is fully cleared before the test. Other drugs used for bowel cleansing: Bisacodyl, Docusate sodium, and magnesium sulfate. Important safety points: avoid these in severe bowel disease, obstruction, or very frail patients. Common side effects include tummy discomfort, nausea, or mild dehydration, but these can be reduced by drinking plenty of clear fluids and taking the solution slowly. In simple words, all these medicines have the same goal: to clean the bowel completely so doctors can get a clear view during a procedure. And remember, staying hydrated is key for safe and effective bowel cleansing. Okay, now that we're talking about constipation, you can get an idea about these other drugs. Constipation. Constipation is when passing stools feels unsatisfying. Maybe it's not happening often, maybe it's hard to pass, or you feel like it's incomplete. It can happen at any age, but it's more common in women, the elderly, and during pregnancy. Now, one thing to remember is that bowel habits are different for everyone. Some people think they're constipated just because they don't go every single day, but that's not always true. However, if constipation starts suddenly, especially in someone over 50, or if it comes with red flags like anemia, tummy pain, weight loss, or blood in the stool, that's a warning sign and should be checked urgently. Sometimes constipation can be caused by certain medicines, so it's always worth reviewing those. For most people, though, the first step is lifestyle changes: adding more fiber through fruits, veggies, and whole grains, drinking enough fluids, and keeping active. Fiber should be increased gradually to avoid bloating, and its full effect might take up to 4 weeks. Fruits and juices that are naturally high in fiber and sorbitol can also help. But here's something important. There are a lot of misconceptions around bowel habits, and this has led to overuse of laxatives. Taking laxatives too often can cause problems like low potassium, so before using them, it's important to be sure the person really is constipated and that there isn't another hidden cause. Let's talk about laxatives now, bulk-forming laxatives. These include things like bran, aspergilla husk, methylcellulose, and sterculia. They're especially helpful for adults who struggle with small, hard stools and can't get enough fiber from their diet. They don't work instantly, though. It can take up to 72 hours to see the effect. Some people may notice bloating, gas, or cramping, so it's important to drink plenty of fluids to prevent any blockage in the bowel. If someone can't tolerate bran, alternatives like aspergilla husk, sterculia, or methylcellulose can be used. And here's a bonus: methylcellulose also works as a stool softener. Next up are stimulant laxatives. These include medicines like Bisacodyl, sodium picosulfate, and natural ones from the anthraquinone group such as Senna. They work by speeding up bowel movements, basically increasing intestinal motility. But they often come with abdominal cramps, and they should never be used if there's an intestinal blockage. Some types, like codanthramer and codanthusate, are reserved only for patients who are terminally ill because studies suggest possible cancer risk with long-term use. There are also a couple of special ones worth noting. Docusate sodium, which acts both as a mild stimulant and a stool softener, and glycerol suppositories, which work as a lubricant and a gentle rectal stimulant. Now let's move on to fecal softeners. These work by reducing the surface tension of the stool, so more fluid can soak in and soften it up. Common examples are Docusate sodium and glycerol suppositories, both of which help make stools easier to pass. Enemas containing arachis oil, that's groundnut or peanut oil, can also be used to soften hard impacted stools and help with bowel movements. Liquid paraffin has been used as a lubricant too, but it's not recommended nowadays because of side effects like anal leakage and more serious risks such as lipoid pneumonia if it's accidentally inhaled. Next up, osmotic laxatives. These work by pulling extra water into the large bowel. That extra fluid helps soften the stool and makes it easier to pass. One common example is lactulose. It's a special sugar that doesn't get absorbed by our gut. Instead, it creates a gentle diarrhea effect, lowers the stool's pH, and even reduces harmful ammonia-producing bacteria. That's why doctors often use it in patients with hepatic encephalopathy. Here's a simple idea about hepatic encephalopathy. Hepatic encephalopathy is a brain problem that happens when the liver can't clear toxins, especially ammonia, from the blood. These toxins then affect the brain, causing confusion or drowsiness. Now, lactulose helps here because it traps ammonia in the gut and makes you pass it out instead of letting it reach the brain. So it's not just a laxative, it's actually protecting the brain too. Another group is macrogols. You might see names like macrogol 3350 combined with salts such as potassium chloride or sodium bicarbonate. These are polymers that trap water inside the bowel, and if you drink plenty of fluid with them, it helps prevent dehydration, which sometimes happens with other osmotic laxatives. Next, let's look at some other medicines used in constipation. First up is linaclotide. This one is mainly for people with irritable bowel syndrome when constipation is a big issue. It works by increasing fluid in the intestine, speeding things up, and even reducing belly pain. Then we have Prucalopride. This medicine activates serotonin receptors in the gut to give the bowel a gentle push. It's usually given when regular laxatives just don't do the job, especially in adults with long-term constipation. All right, don't go anywhere just yet. We still have some really important points to cover. So stick with me till the end of the video. And hey, if you're serious about growing in the medical field, remember, consistency beats laziness every time. Now let's talk about how constipation is managed. For short-term constipation, if diet changes don't help, we usually start with a bulk-forming laxative. But remember, plenty of fluids are important. If the stools are still too hard, an osmotic laxative can be added. On the other hand, if stools are soft but still difficult to pass, a stimulant laxative may be the better choice. When constipation is caused by opioid medicines, bulk-forming laxatives should actually be avoided. Instead, the best approach is an osmotic laxative or Docusate to soften stools, plus a stimulant laxative. If these don't work well enough, newer medicines like naloxegol or methylnaltrexone can be used. For fecal impaction, treatment depends on stool consistency. Hard stools often need high-dose macrogols first. If stools remain stuck, stimulant laxatives or rectal options like Bisacodyl or glycerol suppositories may be used. Sometimes enemas, such as sodium phosphate or arachis oil, are needed to fully clear the blockage. And finally, in chronic constipation, we again begin with bulk-forming laxatives and good hydration. If stools are still hard, osmotic laxatives like macrogols or lactulose, if macrogols aren't suitable, are added. If that's not enough, a stimulant laxative can be added too. The goal is to achieve 1 to 2 soft, formed stools daily. In stubborn cases, where at least 2 laxatives at proper doses haven't worked for 6 months, medicines like Prucalopride may be considered, especially in women. And once things improve, laxatives can be slowly reduced, usually tapering stimulants first while adjusting osmotic doses if needed. Now, what about constipation during pregnancy or while breastfeeding? First, lifestyle and diet changes are always the best start. If that's not enough, fiber supplements like bran or wheat are safe and helpful. During pregnancy, the first choice medicine is a bulk-forming laxative. If stools are still hard, osmotic laxatives like Lactulose can be used. Sometimes, if extra help is needed, stimulant laxatives like Bisacodyl or Senna may be tried. But Senna should be avoided near the end of pregnancy or if the pregnancy isn't stable. For breastfeeding moms, bulk-forming laxatives are also the first choice. If that doesn't work, lactulose or macrogol can be used, and a short course of stimulant laxatives is possible too. So, the approach is always gentle first, then stronger if necessary. Now let's talk about constipation in children. Early treatment is really important because if it's delayed, constipation can turn chronic or even cause painful fissures. The first-line treatment is not just diet. It's a combination of a laxative plus healthy habits like more fiber, fluids, and exercise. But unprocessed bran isn't recommended since it can cause bloating. For most kids, macrogols are the first choice. If that's not enough, a stimulant laxative can be added, and if stools remain hard, lactulose or Docusate can help. Treatment often needs to continue for weeks or even months, and doses are reduced slowly to avoid relapse. And that's it. This is your short note for today. Try to take a little time every day to watch and revise these topics. It will really help you move forward in your medical journey. In the next video, we'll be diving into diarrhea, so don't miss it. Until then, don't forget to like, share, and subscribe. It really supports the channel and keeps us learning together.